Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way. Happy Monday evening, guys. Hope you had a great weekend, and I hope you had a great, enjoyable Monday. A lot of people hate Mondays. I actually like it. I love what I do. So Mondays are a great opportunity to be able to serve people in the office. And yes, Mondays are always the busiest day and the times that I get home the latest. If you guys are joining us right now, we're going to be talking about fertility part 2. If you didn't watch part 1, go back. We talked about one of the reasons why IVF is mostly unsuccessful, mainly because you're actually taking someone who is not biologically wants to reproduce, try to force it. And so I made the statement of, hey, listen, if you are having problems with the menstrual cycle, if you're having a problem with fertilizing an egg, just remember this, maybe the body is actually saying, hey, not right now. Now is not a good time, because health, a normal fertility cycle, is an indication that you have your health. So it's just one of the things that healthy people are going to have a normal menstrual cycle. Now, there's a lot of different reasons why there could be problems and struggles with infertility. And I know that mentally it is so stressful. I feel for you people that are dealing with issues with infertility, especially. But when you look at the number of couples who are struggling with infertility, something is going wrong, and we need to start figuring out the reasons why, especially. So we talked about some of the why IVF can be so unsuccessful, and it's doggone expensive as well. And a lot of times what we want to do is the women will start to seek ways in order to help improve their fertility with leaving the men or the man out of the equation, or the male out of the equation. And one of the things I'm going to go over with you today is the men in many cases are just as responsible for infertility as the woman. Now, the woman has a lot more working parts, a lot more moving machinery that has to go on. But just remember this, the health of the man will determine the quality of the sperm, okay? Just as an FYI, this is probably a PG-13 live video, so if you haven't taught your kids about the birds and the bees, now is not a good time, for them to be watching, all right? So what about men? That's what we're going to go over. So guys, welcome again. If you are watching right now, make sure that you say hello. Please let me know where you're watching from. And also, let me know if you're watching this on replay. Just go ahead and let me know where you're watching from, and let me know that you are watching the replay as you play it back in the next couple of days. Just as an FYI, guys, because I know I get so many messages of people reaching out, and they want very specific, health advice. And guys, I try to respond as vanilla as I can, because, guys, many of the questions that people will send me are they'll say, what about this, or what about that, or what's your opinion on this? And there's not a lot of context behind the question, so it makes it very difficult to understand. So just, guys, as an FYI, we do these live videos just to help you get understanding of ideas, but many times people will ask a question that is really largely dependent on testing as well. So it just makes it really impossible to answer questions when people are seeking specific health advice. And many times they'll say, you need to find a Wellness Way doctor, make sure that you're getting tested properly, and then whether that person actually does it or not, I don't know. But guys, if you're asking a question, just make sure that you will do what the answer is. So many times people are just actually looking for an answer to a question that just solidifies what they want the answer to be, and they don't like necessarily the answer. So guys, I apologize if I can't get back to specific questions. Is that I know that I'm in full-time practice right now, probably working 60, 70 hours a week, and going live on Facebook, and have kids that are in 3 different sports right now, so life gets pretty hectic and crazy to be able to answer literally all those questions. I do go back and try to like all your comments as well, and sometimes if I'm feeling inspired and energetic, maybe I'll answer that question as well, but I know it's really, really hard to get to all of them. But nonetheless, I appreciate everybody who watches. I appreciate your interaction, truly, from the bottom of my heart. Thank you so much. You guys make it an absolute joy to be able to bring this information to you. So keep liking, keep commenting, in order for us to stay inspired to keep bringing you guys awesome clinical information. So let's get into it about fertility, specifically about men. Guys, I've done a lot of different videos on basically testosterone and why testosterone has been in decline over the last 30 to 40 years. It's not a genetic issue, it's an environmental issue 100%. And that's one of the things, because again, what determines the quality of the sperm is actually testosterone signaling, okay? So here you got luteinizing hormone, you got follicle stimulating hormone, and that'll actually stimulate the development, release, maturation of the sperm. And you have low testosterone, you're going to have a low sperm count, but there's other factors that are involved in determining how strong are the sperm, the number of sperm, and things like that. And that's what we're going to go over in just a second, okay? Now, this actually comes from the CDC, and they actually go over as far as infertility in relation to all genders. Now, I'm going to make a connection between all of these different things because, number one, these factors increase the risk of infertility in all genders. Age, over 35 for women, over 40 for men. Now, is that true? Yeah, people do have more problems conceiving after those ages. However, we're biologically programmed for men to be able to reproduce up until the time of death. We're also biologically programmed for women to be able to give birth until they hit menopause. Think about it. If you weren't supposed to, then why would you continue to have a menstrual cycle? It just makes it harder because our lifestyle and what we are doing, those stressors, physical, mental, chemical, what they're doing is they're beating up your body. Now, I will also say this is, ladies, if you're having a problem with your menstrual cycle and you are 18 years of age, the doctor puts you on birth control, don't expect and do nothing in order to actually correct it. Don't expect to go off of birth control and magically be able to conceive, because if you're having problems at 18, continue to live a poor lifestyle, don't expect yourself to be fertile at 25, 26, 30, 35 years of age. There's a reason why your menstrual cycle is suffering. You need to get the reason why. Doctors won't tell you the reason why. In fact, I was just in a consult with a woman today, and she looked at me and she said, I wish I would have met you so much sooner, because all the doctors wanted to do is throw birth control at me, and I knew that wasn't the answer. It didn't sit well with me, and I feel like I'm missing out now because I wasn't able to conceive, and I had problems with my menstrual cycle for so long, and now she's 42 years of age, and she finally has a normal cycle when she has been working with me over the last 6-7 months. So age really doesn't have to do with it as much as the older you get and the more you're beating up your body, then of course you're going to have more problems the older that you get. This whole idea behind age is absolutely ridiculous because it's just sustained injury over time and it has nothing to do with your biological age. Number two, diabetes, 100%. Eating disorders, including anorexia nervosa and bulimia. I'll actually talk about this next week a little bit, actually about how leptin is actually a fertility hormone, and when people are starving themselves or throwing up, then actually will throw your leptin levels and your leptin receptors completely amok. And basically what the body does is says, I am in starvation mode and now is not a good time in order to have a baby. Excessive alcohol use because of how it inflames the liver, exposure to environmental toxins such as lead and pesticides. Yes, guys, we have a higher pesticide exposure than ever before. I want you to think about glyphosate, things that are on a lot of grains, corn, soy, oats. High glyphosate load actually change the enzymes within the liver, these cytochrome P450 enzymes, and actually will massively inhibit the ability of the liver to be able to detoxify. Over-exercise, guys, we talk about that quite a bit. So over-exercise, even in men too, will lower testosterone, but over-exercise in women will actually lower progesterone levels. So that's why sometimes we tell people, hey, you need to take it easy in regards to the exercise. Radiation therapy, obviously because of how it actually kills stem cells within the bone marrow. Sexually transmitted diseases, that's an inflammatory issue that can actually change the anatomy of the ovaries, the uterus, or of the testicles. Smoking, obviously inflammatory. High stress, which will rob hormones, substance abuse, and weight problems, obesity or being underweight. So guys, you can be underweight, you can actually be overweight, and obesity, especially when it comes to men and women, and having blood sugar issues can actually lead to changes in sperm quality, and in women it actually can lead to things like polycystic ovarian syndrome, okay? The inability to be able to ovulate correctly. Now, what are the factors for female infertility? I'll go over this in a lot more detail next week, but abnormal menstruation, well, no duh. because that is a sign that you are releasing an egg and you have a proper field for that egg to be able to be fertilized. Blocked fallopian tubes, that usually is due to either anatomical or chronic inflammatory issues, celiac disease, which is an inflammatory issue, kidney disease, past ectopic tubal pregnancies, pelvic inflammatory disease, again, inflammation, pituitary gland disorders such as Cushing syndrome, which is really caused by some kind of benign tumor that's secreting hormones on the pituitary gland. PCOS, again, comes down to weight problems and testosterone, and also with insulin levels. Ovarian cysts, primary ovarian insufficiency. So actually sometimes some people may not have enough eggs that are in reserve. Sickle cell anemia, uterine problems including endometriosis, uterine fibroids, uterine polyps. Guys, this is a hormone signaling or hormone issue. Again, you have to be able to correct and fix the hormones, which starts with inflammation first, and then also if you have any kind of undiagnosed thyroid disease, which, guys, most issues of thyroid disease actually can be linked back to having an autoimmune response against the thyroid gland. Okay, so all of these, there's a lot of different factors when it comes to infertility, but I'm going to show you some common denominators, especially when it comes to men. Now, the Centers for Disease Control, the CDC, which I don't actually agree with all that much, I agree with some of what they're actually saying when they talk about this. Let's talk about infertility in men, okay? Now, how they say that how you can actually look at infertility when it comes to men, the first thing that they actually run to is they look at a semen analysis in which they're actually looking at the content of the semen, the type of sperm, their ability to be able to move, their ability to be able to swim. They're looking at all different kinds of things, including nutrient content within the semen. But I'm going to say, yes, you can actually do that, but there's also some markers that you can look at just to say, hey, if these markers are abnormal, then obviously my semen analysis isn't going to be very good, okay? So they say that a semen analysis helps determine if and how male factors are contributing to infertility, which I actually agree with. Now, here is some of the things that can happen when a man is actually suffering with infertility or is a contributor to it. Number one, when you have a varicose, okay? So basically what that is swelling of the veins, and it actually causes the testicles to get enlarged. A lot of times that can happen if there's been some kind of trauma. Also, trauma to the testes affects sperm production, result in lower number of sperm. Heavy alcohol use, smoking, anabolic steroid use, because again, it will cause shrinking of the testicles, and illicit drug use. Cancer treatment can also do it because of chemotherapy, radiation, and surgery. Actually, chemotherapy can lower sperm count because of just how toxic it is, or if you've had surgery to remove one or both of the testicles. Okay. Now, interesting, what they talked about is diabetes or other autoimmune disorders and certain type of infection may cause testicular failure. We had something very interesting in actually a young boy. We actually measured his testosterone, and it was only hovering right around 200. But when we looked at his some of his white blood cell counts, was very, very, very inflamed and had an active infection as well. Okay. Now you can have some hormone dysfunctions, improper function of the hypothalamus or the pituitary gland. These are the ones that actually signal things like luteinizing hormone, follicle stimulating hormone, that signal actually the testicles to start to produce sperm, which then signals, or produce testosterone, which then will signal the production of actually sperm within the testicles. So yes, you can have some issues actually within the pituitary gland, and a lot of it can be due to problems with head trauma and multiple concussions. Auto accidents can contribute to it as well, but also if you have any kind of pituitary tumor, okay? So looking at this, but they say some other interesting things, is they say exposure to too much estrogen, which is also true because, guys, look at where you are having specific estrogen mimickers in your everyday life, like your plastic water bottles, some of the lotions that you put on your skin, all contain things like parabens, like methyl paraben, propylparaben, butylparaben, and those things can get absorbed through the skin and can actually mimic estrogens within the body, okay? So there's a lot of different use. Also, what they say is chronic use of medications called glucocorticoids. So if you are on some level of steroid, corticosteroid, either you're injecting it because of chronic pain or you have some kind of autoimmune condition which you're trying to knock out the immune system and increase cortisone, then that will also send a signal back to the brain saying, I'm highly inflamed, and that can actually cause problems with testosterone signaling and consequently sperm production. So there's a lot of different reasons why, but basically, guys, when it sums up to an issue with toxicity, inflammation, blood sugar, and it also is an issue with maybe you've had some kind of trauma. Now, here's what's amazing, because I don't know how many times when people go for some kind of fertility consultation with the doctor, before they run all these different kinds of testing, are they actually talking about to the man, is they saying, hey, let's check your blood sugars, okay? So this comes from PubMed, December of 2015, and it said this: it's the effects of diabetes on male fertility and epigenetic regulation during spermatogenesis, or the production of sperm. What are they talking about when they talk about epigenetics? They're saying, hey, epigenetics above genetics, meaning genes respond to environment. I want to say that again. The genes respond to the environment. So you don't have bad genes. The genes are bad because the environment is actually causing the genes to adapt. So here's what they say. An important complication of diabetes is the disturbance in the male reproductive system. Glucose metabolism is an important event in spermatogenesis, or production of sperm. Moreover, glucose metabolism is also important for maintaining basic cell activity, as well as specific functions such as motility and fertilization ability in mature sperm. Epigenetic modifications are essential during spermatogenesis, okay? Now, diabetes may influence the epigenetic modifications during spermatogenesis or production, and that these epigenetic dysregulation may be inherited through the male germline and passed onto more than one generation, which in turn may increase the risk of diabetes in offspring. Holy cow, that's a bunch of words, but let me lay it out for you. Basically, what they're saying is diabetes plays a role in male fertility. Or not even diabetes, but what about pre-diabetes or high insulin levels and eating tons of sugar and tons of junk food, okay? But what's so interesting is that what they're saying is, and there's other articles that will agree with this, is one of the things that they actually say is they say, you know, people are taking metformin, or people with type 2 diabetes, it changes the quality and the genetic content of the sperm, basically mimicking the health of the person at that moment, the health of the male at that moment. And basically, if you are sick and you're passing on the health of that sperm at that moment, then basically what you're passing on is you're passing on potential of damaged genes, which will then predispose your offspring to the same problems you are suffering with when you conceived. That is a lot of pressure. That's why I tell couples, I say this needs to be a process, and the goal is to get you as healthy as possible, so that when you conceive, your epigenetic expression is in a really, really good place. Hopefully that makes sense. So diabetes plays a role in male fertility, but also in your genetic expression of the sperm. That means you better be healthy, or as healthy as possible, when you decide that you are going to have kids. Now, also coming from the Journal of Clinical Medicine, is they said diet and nutritional factors in male fertility are underestimated factors. This was published May of 2020, so a little over 2 years ago. Here's what they said. In up to 50% of cases, infertility issues stem solely from the males. Not always a woman's problem, woman's issue. The quality of human semen has deteriorated by 50 to 60% over the last 40 years. Let me say that again. It has deteriorated 50 to 60% over the last 40 years, since basically the early 80s. So obesity, okay, affects the structure of the sperm, but also the development of the offspring and their health in later stages of life. That's, again, epigenetic expression. In obese individuals, disorders of the hypothalamic pituitary gonadal axis, meaning brain hypothalamus to the pituitary and then to the testes, are observed, as well as elevated estrogen levels with a simultaneous decrease in testosterone, luteinizing hormone, and follicle stimulating hormone that are released from the pituitary gland. So guys, if you are doing things that is converting the testosterone into estrogens or into estradiol, basically what you're going to see is you're going to see a loss of signaling at the pituitary gland for you to be able to make testosterone. This is why when you look at estrogens and you look at testosterone, they're different from one another. They're in competition. So if you're taking testosterone, you're taking your testosterone and you're aromatizing it into estrogens, one of the factors is an increase in obesity, increase in fat cells, because that's actually what they do. Then what you're doing is elevating your estrogens, and you're going to be tanking your testosterone, and then you're going to have a lot less quality of sperm when you do some kind of analysis with it. So healthy parameters such as sperm count, sperm concentration and motility, and lower sperm DNA fragmentation actually occur when you have healthy dietary models. Now, they actually don't talk about healthy dietary models, but we know what a healthy dietary model actually looks like, okay? So apart from mineral components such as zinc and selenium, the role of omega-3 fatty acids and antioxidant vitamins should be emphasized, since their action will primarily be based on the minimization of oxidative stress and the inflammation process. Interesting, right? When they're going back to inflammation and talking about chronic inflammation and how it actually lowers your sperm count, lowers your testosterone and things like that. So inflammation is one of the drivers, guys, especially when it comes to fertility, okay? So look at male fertility, guys. Number one, what can it be caused by? It can be caused by toxicity. Chemotherapy can do it. Or also an impaired ability of your liver to be able to clear your estrogens too. So this is a product of your liver health. If you decide that you're going to be eating a bunch of hydrogenated oils, drink a bunch of alcohol, and then consume a lot of high fructose corn syrup, well, there you go. There's your problem with your liver. And you're going to have a problem with your ability to be able to regulate energy. You're going to have a problem with being able to maintain normal blood sugar. You're going to have a problem with being able to lose weight, and you're also going to have a problem with being able to clear your estrogens. Okay. Number two, inflammation. So what can also cause a decrease in testosterone, and then problems with sperm count, motility, et cetera, et cetera? Well, infection, autoimmunity, specifically that if you are on corticosteroids, and then another big factor is going to be insulin resistance. Guys, your insulin levels should be about 3 to 5. Most people, when we measure, are somewhere in between 15 to 25, and the largest I've ever seen is 900. Okay, and then the third thing, which is usually the least thing that's contributing, is actually when you have a direct physical trauma to the testicles. But again, you can also have a trauma to the brain that is affecting the signaling to the testicles, and that's why you'll see a lot of changes in men when they have had any kind of repetitive head traumas, concussions, things like that. So you'll see it in auto accidents. This is why a lot of times men coming back from the military who had multiple concussions. This is also, even people who have chronically got concussions by playing high impact sports and things like that can take its toll, obviously, over time. So there's a lot of different factors that are going to be contributing to it. Now, this actually right here is what a lot of people are going to run to, and this is by doing an actual semen analysis. Okay, so a lot of times if they go to a fertility expert, this is the first thing that they're going to be looking at. So they're going to be looking at how much sperm do I have, how well do they move, how are they shaped, the morphology of it, is there any evidence of inflammation in the semen. So if this is out of range, out of range, out of range, out of range, then chances are you have a problem with these things, either one, two, or maybe all three of them. And that's why, guys, what you need to start fixing is you need to start fixing your lifestyle. That requires a lot more work, but just remember, fix your lifestyle to create healthier sperm, healthier genetic expression, and you'll be doing a favor for your future kids especially. So, Dr. Nate, what would you do if someone came in and said, hey, I'm infertile? A lot of times I'll look at both the couples and I'll say, I need to see both of you, okay? Usually the man is like, oh no, I'm really good. I am, and it's just an ego thing. But again, at the end of the day, if you want a child, both of you have to be a contributing factor, to the future of your children. So, Dr. Nate, what testing would you do? Number one, I would actually take an x-ray. So I would look at an x-ray. I would look at what is happening structurally, especially with the neurology that allows for the body to get into rest and digest versus fight or flight. And I also would look at the neurology down at L3, L4, L5, which actually affects the neurological signaling to the testicles. Number two, I would check hormones. So I would do a male panel, may even do a Dutch panel, because male panel at a blood test is actually looking for the production of testosterone, but a Dutch test will actually look at the metabolism of your testosterone and how it's aromatizing into your estrogens and how the liver is actually clearing out those estrogens. Yes, you can do a semen analysis, but also you want to look at some of these inflammatory triggers as well, because if you see a high inflammatory issues on the male panel, then you have to start looking at why is that. So are there things like food allergies, stool, what is C-reactive protein, and start looking at where those inflammatory triggers are actually starting to come from, okay? So let me say this, guys. You are biologically programmed to reproduce and produce testosterone and sperm for your whole entire life. Let me say that again. Biologically, you are programmed to produce testosterone and sperm your whole entire life. So when men say, yeah, I'm getting older, my testosterone is going down, I say it's going down because you're beating yourself up. Quit beating yourself up. And the longer that you beat yourself up, the older you get. And the more that you're beating yourself up, the body adapts to the changes and how you are damaging your body. And this is why we have taken men in their 70s and gotten testosterone levels from 300 to 700 in 4 to 5 months by changing their lifestyle. And many times the wife will come to us and say, please turn it off. I say, no, can't do. That's where they're supposed to be. That's where men are supposed to be. But in today's age, we have an assault on men who are high in testosterone. We believe that is toxic. But if a man is healthy, they will have healthy levels of testosterone, which makes a man unique. And also a woman's hormones is what makes a woman unique, which is beyond me. Anytime they are trying to manipulate hormones, because many times, check those tests and you will see that something is very wrong as far as production or metabolism within the liver especially. And again, a lot of that can actually come down to having very extreme toxicity with certain chemicals, with certain things in the water, with certain herbicides. Those things will change the metabolism of those hormones. And again, hormones will influence behavior quite a bit. So again, guys, you're biologically programmed to produce testosterone and sperm for your whole life. It's just that you just keep beating it up and refuse to change the necessary things in order to get it back to normal, okay? So what will cause this? What can cause a decrease in sperm numbers, motility, health? What causes all of that? Guys, it comes down to this. It comes down to, first and foremost, addressing inflammation. And these are the big ones when it comes to men. Chemical, physical, but guys, even chronic mental stress over time will decrease a man's testosterone. Not so much acute, but when it becomes chronic and when it becomes unrelenting. And guys, if you refuse to start addressing these things, then what you're going to do is you're going to go to the fertility expert, and then they're going to harvest your sperm, and then what they're going to do is they're going to combine a sick egg and a sick sperm that it has genetically changed according to your health status. And what happens is many times you're going to have a child that's going to express sickness, illness, and disease. So the goal of fertility is make yourself healthy so that you have the best expression and you're giving yourself the best chance not only to conceive, but also the best chance for you to have a healthy baby genetically. Hopefully, guys, that makes a lot of sense. So, guys, what would you do? Dr. Nate, what would you do? Well, a lot of guys of what we do is very, very specific, but there's some things for a man especially that aren't going to hurt you if you started doing some of these things. Number one, men, decrease your sugars, okay? Get off of any processed sugar. I also say for a lot of men, get off of fruit. You don't need any more fructose processed from your liver. It's already inflamed and fatty enough, which so many people lose their mind because, Dr. Nate, you're saying you shouldn't eat fruit. No, I'm not saying you should eat fruit because if you had a great lifestyle, you could handle fruit with no problem. But when we are trying to help the liver, we say, hey, you can live with veggies and you can get your nutrient content, you can get your fiber from veggies, and you can actually live your whole life without fruit. So a no sugar diet, 100%, okay? The other thing is start getting on a liver glandular. We also will put a lot of men on testicular glandulars, literally bovine testicle, because remember this, like can help to heal like, and a lot of it's going to be based on testing. But also taking some added zinc will help with testosterone production as well. I see so many people who take zinc isolates all the time, and they're taking 100 milligrams of zinc every single day, and they've been taking it for a year and a half to 2 years. They're actually becoming very copper deficient, which is why if you're going to take zinc, we have it encapsulated that is coming from oysters, okay? And there's other things that you can do. Tribulus is great when it comes to testosterone signaling, meaning it affects things like luteinizing hormone, follicle stimulating hormone. Astragalus actually can help to increase testosterone. It also will help to increase stem cells within the bone marrow. Astragalus also does a great job of actually helping with DNA repair known as methylation, and even gymnema can help with testosterone because what it's doing is it's actually slowing down the absorption of sugars across the intestinal lining so that you can actually start to catch up and not become so insulin resistant. Guys, another one is doing high intensity exercise. So if you follow my other page, Dr. Nathan Thompson, which actually I just post from Instagram and it goes over to the Facebook page. I post a lot of workout stuff because maybe a lot of guys actually ask, hey, I want to follow you along with what you're working out because I want to do what you are doing. High intensity exercise, guys, is incredible, mainly because it's helping so much with blood sugar, mainly because it's helping with testosterone signaling. But guys, you should be doing high intensity exercise. We do not move enough in the United States. We do not move, and it is so sad to see someone 40 years of age who can't squat, can't pick things up off the ground, can't press things overhead, and it's leaning forward. I mean, we need to be moving so much more because we sit at a desk and we sit at our sporting events and we don't do anything to take care of our physical frame, and it is sad to see people devolve as they get older when they don't need to. So you can get some high intensity exercise tips if you go to our Instagram page, Dr. Nathan Thompson, and also on Facebook. And I'll post what I do for a workout. A lot of times you'll see me working out with my kids because I'm getting them started early on movement and on high intensity exercise. And then the last thing is to take about 3 to 4 grams of EPA, DHA, which are actually the animal sources of omega-3 fatty acids, not only for inflammatory effect, but also for the effect of having a higher amount of fat and the effect that it has, actually, because remember, your hormones are all basically fat-based, okay? So that would be a great start for people. There's other things that you should do too in regards to if people have some inflammatory conditions of the GI system, things like reflux. And this is why, guys, when people say, well, what can increase my testosterone? And I say anything that is going to decrease physical stress anything that's going to decrease mental stress, and anything that is going to decrease chemical stress has potential to increase your levels of fertility. And this right here is not a protocol. We would call it probably a good start, especially. So what would you test? I would test probably total and free testosterone. There's a difference between total. There's a difference between free. High sensitivity C-reactive protein. Check a CBC with a differential and see, the types of immune cells that are taking place. If someone's got a very high amount of neutrophils, not good. People have low lymphocytes, not good, as well. And you can actually get a lot of information just from a CBC with a differential. And then measure your insulin levels, which would be 3 to 5, and your A1C technically should be about 4.9 to 5.1, 5.2. Most people that we test are usually hovering between 5.6 and 7. Which makes them actually either almost pre-diabetic, or type 2 diabetic. And so you got to get those things under control. Remember this, is that diabetes, no one dies of diabetes. Let me say that again, no one dies of diabetes, but having uncontrolled blood sugar, it's what you do to cause the diabetes that causes so many issues with joint deterioration, with vascular deterioration, and atherosclerotic plaquing, and high inflammation, poor collagen metabolism. That's what actually causes what you're doing in order to create that problem. Guys, and I've said this before, type 2 diabetes is actually an adaptation. And if your body didn't adapt to type 2 diabetes, you would have died a long, long time ago. It's the body trying to adapt to try to protect you as well, which means that if you're just trying to lower your blood sugars with a medication, you're not even hitting the tip of the iceberg. It is an adaptive mechanism, which means you have to get to the cause as far as why it is happening. And not all the time is it due to too much sugar. It can be related to the microbiome. It can be related to chronic elevated mental stress. There's so many issues when it comes to losing your blood sugar control. So guys, this makes sense to you and you're watching from the Chicagoland area, and maybe you are suffering with fertility, or maybe you're suffering with chronic pain, or maybe you're suffering with inability to lose weight, or cancer, thyroid disease, or some kind of hormone issue, autoimmune condition, type 2 diabetes. Get to our inflammation talk coming up. It is pinned to the top of the page. It's going to be in September. Don't quote me on the date. I believe it's September 13th. But on that Tuesday night at 6:15 p.m., it's an in-person event. We're going to talk to you about inflammation. We're going to talk about how you look for it, how you test for it correctly, and really the first steps that you need to be doing in order to start taking control of your health. That's where you start as far as the journey. Guys, what we do in the office is not a one-shot deal. Like we're going to shove a bunch of turmeric in you and all of a sudden you're going to get your health back. There is no secret formula. There is no secret, recently discovered plant from the Amazon rainforest that's going to turn your life around. It is the unrelenting pursuit of getting better with your health every single day, because you didn't get sick overnight and you're not going to miraculously get better overnight. You need to do the right things and then give it time for the body to rebuild, to repair, to lower inflammation, and then build itself back up after that. So guys, and if that is you and you're from the Chicagoland area, go to the top of the page, register for the inflammation talk. It is free to attend. However, space is, as always, going to be limited. So next week, guys, I'm going to talk about fertility part 3. What about women? So there's a lot more moving parts. So I'll try to get it in one live video. If I can't, I'll do it in 2. But a lot of things are going to be really awesome when it comes to a woman's liver, anatomical issues that are going on, with estrogen metabolism, progesterone, things like that. But I will give you a preview, guys, as most of a woman's fertility issue is going to come down to 2 things. It's going to come down to the immune system, and it's going to come down to mental stress. And if you can handle that, you're going to give yourself a much, much better chance of being able to conceive, especially without something that's expensive, without something that costs $12,000 per shot, and also that has a 75% failure rate every single time. So let's make our bodies healthy again. Here in the United States, we're some of the most chronically ill, chronically sick people, and it is showing through our ability to be able to conceive. And it's time that we start taking the reins, start taking control, and start looking at different solutions for these problems that unfortunately are plaguing so many couples today. So guys, again, make sure that you like this video. Please share this video as well. We'll see you guys coming up a little bit later in the week. I'm going to actually be talking about the new Omicron. This is going to get flagged. The Omicron new therapeutic that they're coming out with, recommending instead of getting the booster. I'll give you my opinion on that coming up later on in the week. But again, as far as this video, please like, please share, please say hello. Guys, be well, be blessed. I hope you have a great night. And remember, health is an inside job. All right, guys, be well.